Hi, this is Dr. Paul Reifenrath for Upper Level Canine, and we had a really fantastic question that is going to take the whole talk. Are there symptoms in dogs that owners ignore and are actually red flags? So this is something we see every day, and I love talking about it. So there's actually 6 different conditions that I'm going to talk about and get into some detail with those. So the first one is obesity or progressive weight gain. This is actually the most common problem that we see in companion animal medicine today. So 30 to 40 years ago, it was unusual to see obese dogs. And there's a couple of reasons for that. Some of the demographic changes that have occurred in those years, from dogs being working dogs and farm dogs and outside dogs to now becoming our household pets. And also pet nutrition and the multitudes of diets that are available to dogs right now. And also spay-neuter status. 30, 40 years ago, there were probably only about half the dogs and cats were spayed and neutered. So this is an influencing factor. Many years ago, actually not many years ago, a few years ago, Purina did a 14-year study on Labrador Retrievers called the Lifespan Study. And they fed Labrador Retrievers to a lean body condition throughout their life. And we also had a control group that were fed a normal control diet. And it was found that the experimental group lived 1.8 years longer than the control group, and with much fewer chronic disease issues and lower body fat percentage throughout their life. Well, that was 15% of their lifespan that was improved during that time period. So we do know that obesity does influence longevity in our dogs. So obesity is also associated with many orthopedic conditions such as hip dysplasia, cranial cruciate ligament disease, osteoarthritis, and some spinal disorders. Obesity can also influence other chronic conditions such as diabetes and fatty liver disease, some skin conditions, some respiratory conditions. Obesity is almost always caused by overconsumption of calories. This is something that we are in control of. And one of the newer things that we're investigating right now is the high carbohydrate content of some of our diets might be an influencing factor with this too. So there are also certain other factors that can influence how dogs burn their dietary calories. And the first one is spay-neuter status. So when we remove reproductive hormones, we are altering their metabolism. So our spayed and neuter dogs should be fed a lower calorie diet than our intact animals. So also we have to consider activity level. If we have an athletic dog or dogs that engage in physical activity every day, they're going to burn their calories more efficiently. Sedentary dogs tend to burn their calories a little bit slower. So we also have to consider endocrine disease, such as hypothyroidism and Cushing's disease. So hypothyroidism is an autoimmune disorder of the thyroid gland. And in this situation, thyroid hormone levels are decreased in the blood. And thyroid hormone is really important for regulating metabolism in the body. Cushing's disease, or hyperadrenocorticism, is caused by a functional tumor in the pituitary gland in 85% of our cases, and functional adrenal tumors in 15% of our naturally occurring cases. We can also see Cushing's disease develop if dogs are on prolonged courses of corticosteroids or prednisone. And all of these will increase cortisol levels in the bloodstream, and this will alter the metabolism of carbohydrates and fats by the body. So we also have to consider orthopedic disease. So if dogs have musculoskeletal pain, they're not going to be moving around as much, and they're going to become more sedentary, and they're going to start burning their calories at a slower rate. If we feed them as they always have been, they're going to gain weight and store all that excess calories and body fat. So as the obesity progresses in these dogs, they're carrying more body weight on those sore joints. And that's going to just lead to a vicious cycle of becoming more sedentary over time. So weight loss is by far the most important therapeutic situation that we can use for our orthopedic dogs that are obese. So that's something that getting them on a weight loss program is very, very important for the success of treating orthopedic disease. If obesity is associated with other systemic illness, like if we have dogs that have hair loss along the trunk of the body or the tail, or they're drinking a lot and peeing a lot, this is something that your veterinarian will want to look into and do some blood work to evaluate for metabolic disease like hypothyroidism or Cushing's disease. So the second condition that we'll talk about is unintended weight loss. This one's a big deal, especially for our geriatric patients. So these are usually accompanied by other clinical symptoms like poor appetite, increased thirst and urination, coughing and exercise intolerance, lumps and bumps and masses, pain, vomiting and or diarrhea. So some of the common causes of unintended weight loss are going to be cancer, chronic kidney failure, chronic liver failure, congestive heart failure, diabetes, chronic gastrointestinal conditions, neurologic disorders, and malnutrition. So unintended weight loss can be difficult for owners to notice, especially if it progresses very slowly and there aren't any other clinical signs that are associated with that weight loss. So it's commonly noticed by your veterinary staff when you bring your dog in, put them on the scale, and they compare it to last visit's weight. Unintended weight loss always warrants a very thorough diagnostic workup. So physical exam, comprehensive blood work, and also diagnostic imaging. So the next condition we'll talk about is exercise intolerance. So this is a decreased ability of the dog to exercise, doing light to moderate exercise. And this is usually noticed by the owner if the dog is lagging behind on their walks, or they lay down while they're walking or doing certain exercises. So, and it may or may not be associated with difficulty breathing or coughing too. So some of the common conditions that we see with exercise intolerance: orthopedic disease, and that can be with or without obesity; cardiac disease or congestive heart failure; respiratory disease like laryngeal paralysis in our older large breed dogs; and also brachycephalic obstructive airway syndrome in our pug-nosed breeds. And also tracheal collapse can be a problem in our toy breed dogs as they get older. So also we can have neurologic disease that can lead to exercise intolerance, and that can be intervertebral disc disease in our dachshunds and our other dogs that are short and long. And also one common thing we see associated with laryngeal paralysis in our older giant or large breed dogs is the peripheral neuropathy. This is a disease of the long nerves of the body, and it is genetic, and our Labrador retrievers are overrepresented in that group. So just about probably over 50% of our Labrador retrievers are affected by this once they reach about 11 years of age. So also we can see, especially in our German Shepherds, we can see degenerative myelopathy, and that is a progressive destruction of the spinal cord that ascends up the spinal cord, and that causes very severe hind limb weakness. So the fourth condition that we'll talk about is increased thirst and urination. So this one usually is noticed by the owner, especially if there's accidents in the house. But if you have a multiple dog household, this one can be sometimes hard to identify. So the causes of this can vary from very mild to very severe. So one of the common ones is diabetes. So diabetes is an autoimmune disorder that affects the pancreas, and it will decrease or eliminate the ability of the pancreas to secrete insulin in response to a meal. And without that insulin, glucose or digested carbohydrates cannot be utilized by the cell. So we have all this excess blood glucose that is circulating in the system, and the kidneys become overwhelmed, and they're not able to reabsorb that glucose back into the bloodstream as the blood is being filtered. So all that glucose pours into the urine, drawing water with it, and we have excessive water loss in the urine. And the dogs have to drink to compensate for that water loss. So diabetes is a very involved disease, and it's typically treated with insulin, twice a day insulin injections given for the rest of the dog's life. And usually dietary management is an important part of that as well. So we can also see chronic kidney failure causing increased thirst and urination. And this is where the kidneys fail to reabsorb water as the blood is being filtered to the kidneys. And so we have this increased water loss in the urine. And the dogs have to drink to compensate for that water loss. This can be kind of a late clinical symptom with kidney failure, and it's not a good symptom. Usually when dogs go into full-blown kidney failure, they're usually going to die from this situation, and there aren't many treatment options to consider with this. If we catch it at a very early stage, kidney failure can be managed with dietary means and some other modalities too. And also we can see urinary tract infections causing increased thirst and urination. So bladder infections are pretty common. They're usually evident. The owners notice those pretty quickly because usually the dog is having accidents in the house. They're asked to go out very frequently, and they may notice blood in the urine and a real foul smell to the urine. Usually bladder infections are treated with course of antibiotics. We can also see kidney infections. These are much more serious infections, and these may not be noticed initially by the owner. So kidney infections can be an ascending infection from a bladder infection up into the kidneys, or we can see bloodborne infections like leptospirosis or dental disease that can settle into the kidneys and cause kidney infections. Kidney infections, usually it's a little more involved treatment, but antibiotics, IV fluid therapy, and hospitalization usually are necessary to treat our kidney infections. So we can also see in our older intact males, we can see prostate infections. So we see two types of prostate infections, chronic prostatitis and acute prostatitis. Chronic prostatitis typically occurs in our middle-aged group of intact males. And usually there's very few clinical symptoms other than some intermittent dripping of blood from the penis. Otherwise, these dogs are acting perfectly normal and are healthy. So treatment for chronic prostatitis usually involves a course of antibiotics and castration. Unfortunately, without castration, we have a very high recurrence rate of chronic prostatitis, and that may lead to acute prostatitis over time. Acute prostatitis is a very severe inflammation of the prostate. And these dogs are clinically ill. They are not feeling well. They're depressed, lethargic, not eating, running high fevers. They're painful, and they usually have difficulty urinating and defecating. And defecating because the prostate is so large, it's pressing on the colon, and they have a hard time going to the bathroom. So treatment is very similar to our chronic prostatitis, usually antibiotic therapy. We may need intravenous antibiotics. We may need hospitalization. We may need advanced pain therapy because these dogs are really painful. So the last condition that can cause increased thirst and urination that we'll cover is what's called psychogenic polydipsia. So this is a behavioral disorder in dogs that causes them to drink excessive amounts of water and to urinate excessively. Usually these are young, healthy, active dogs, and there is a stress component to this. We can also see obsessive compulsive disorders influencing this, and usually treatment is behavioral. Usually we want to get them more exercise, increase play with these dogs, and stress management if we can, and also usually a very highly supervised gradual reduction in their water intake. So that's something that you can certainly discuss with your veterinarian. It is a pretty common problem that we see in our young active dogs. Usually in our large breed dogs too. It's common to see in Labrador retrievers, pointers, golden retrievers, and German shepherds. So the fifth condition we'll talk about is one that's very, very common, and that's dental disease. So dental disease is not always noticed by the owner unless they're looking in the dog's mouth frequently. And they may notice halitosis or a discoloration to the teeth. So it's pretty amazing that dogs typically don't show us a lot of clinical signs, even with severe dental disease. So some of the things that we can see is they may be chewing on one side of their mouth, they may be swallowing their food whole, and in real severe cases with a tooth root abscess, you may see a very large lump develop right below their eye, and that's an abscess of the fourth upper premolar. So dental disease can also contribute to other clinical diseases, such as myxomatous mitral valve disease, which can lead to congestive heart failure, especially in our small breed dogs. It can influence kidney disease, liver disease, and also nasal disease. Sometimes we will see tooth root abscesses of the canine teeth, the upper canine teeth, that will erode right into the nasal passage and cause a chronic with basically a hole between the mouth and the nasal passage, which are very difficult to treat. So dental disease is typically noted on a physical exam, but we usually cannot determine the extent of the dental disease without more thorough exam, usually under anesthesia. So under anesthesia, we usually do that prior to a dental cleaning. And we also use full mouth radiographs to determine if the gums in the bone and the tooth roots are in good shape. So depending on the extent of the dental disease in dogs, there are various treatment methods that we can use, from dental cleaning to periodontal treatments to root canal therapy to crown restorations, and even with dental extractions, which are actually pretty common. And if the tooth is loose, there's really nothing we can save in that tooth, so we have to extract that tooth. So dental disease is typically influenced by skull and jaw conformation. So we tend to see more dental disease in dogs that have shorter snouts and longer snouts. Dogs that have a more wolf-like skull appearance, like our German Shepherds, our Labs, and our Golden Retrievers, we tend to have fewer dental problems with those dogs compared to our Pugs, our Poodles, our Dachshunds, and our Greyhounds. So the last condition that we'll talk about is an important one, and that's pain. How can we tell if our dog is actually in pain? So not all dogs will express their pain in ways that we can recognize. So the individual pain tolerances in each dog is different, and even in each breed it's different. So we're all familiar with acute severe pain, like the pain of a broken bone or a sprain, or spinal pain, nerve pain, any other kind of trauma. Dogs will vocalize that kind of severe acute pain. It's the chronic low-grade to moderate-grade pain that is really hard for us to interpret. And this is the pain of osteoarthritis. This is the pain of dental problems, dental disease, the pain of intestinal or abdominal pain, and some other musculoskeletal disorders, as well as skin and ear disease. So usually dogs don't vocalize in these situations. So some of the common behavioral signs that we see with chronic pain include lethargy or inactivity. We'll see restlessness and poor sleep quality. We'll see panting inappropriately. So there's no reason for them to be panting, and they'll be kind of laying there or walking around panting inappropriately. That's a big red flag for being painful. So reluctance to move. And another one we see is aggression or growling or snapping when they're approached. So avoidance of human contact or isolation. Decreased appetite. We can also see a hunchback appearance or a praying posture where they have their front end down and their back end up. We typically see that with abdominal pain. So we can see lameness or shifting weight off of a sore leg. We can see a tilted head or ear posture, which is going to indicate ear pain. If we see a dog squinting or having sensitivity to light, or if they're becoming very head shy, that can indicate ocular or eye pain. We can see moaning and groaning, especially when they're getting up and getting down. They can also have a tragic facial expression, and this is where they have their lip corners kind of pulled back, and they have a furrowed brow, and they just have a very worried look on their face. We can also see teeth grinding. We see that commonly with dental pain. So also excessive drooling, we'll see that with nausea, and we'll see that with dental pain as well. So regardless of the type of pain that dogs exhibit, it's important to identify that cause of the pain and treat it, and also treat the pain itself. So pain is best managed through what we call a multimodal pain management strategy. And that's targeting the pain fibers that in the damaged tissue that are sending off the pain signal from the peripheral nerve that transmits the information up to the spinal cord, the spinal pathways, which transmits that pain information up to the brain, and in the brain where that pain is processed and interpreted. So we do use many different analgesic or pain management techniques in veterinary medicine, and we commonly use opioids like morphine, hydromorphone, buprenorphine. Usually those are injectable medications, so those are used in hospital. We also use local anesthetics like lidocaine, bupivacaine, ropivacaine. We use NMDA antagonists like ketamine and amantadine, alpha-2 agonists like dexmedetomidine, and nonsteroidal anti-inflammatories like carprofen and meloxicam. We'll also use physical therapy modalities as well to minimize dogs' pain. So with severe pain like cancer pain, trauma, surgical pain, we'll commonly use many, if not all, of these different techniques. And then as the pain subsides in these dogs, we will adapt to their needs and alter their plan, their pain management plan. So with anticipated surgical pain, if your dog is going in for a surgical procedure, it's very important that we do what's called preemptive analgesia. And that's having pain meds on board prior to surgery even starting. We also use intraoperative analgesia to keep these dogs stable during the anesthetic period. And then postoperative analgesia is very, very important depending on the dog's needs and the type of surgery they have. We want to have them on an appropriate plan and for the duration of what we expect that pain to persist. So it's important to understand that all mammals and probably all vertebrates experience pain in the same way, using the same pathways in the body. But all animals exhibit their pain in very different ways. So many animals will hide their pain as a survival strategy. If they exhibit pain, they may be a prey target for a predator. So that's something that we see that especially with cats. Cats are very reluctant to show us pain. And some of our small breed animals that we see, like rabbits and birds and things like that, it's very hard to determine if they're in pain. So the last comment that I'll make is even with common surgical procedures, such as a spay, a neuter, a lump removal, a dental, it's really important to do very aggressive pain management with these animals. In some situations, some dogs will be extremely painful after a very common procedure, and others will tolerate it beautifully without any concerns at all. So it's really important that when you bring your dog in for a surgical procedure, make sure that your veterinarian is following a very important pain management plan. So this has been a great question to discuss. And certainly if you have any questions about any of this, talk to your veterinarian, and we'll see you next time. Thanks.